Welcome to FASTBytes, a series of quick and easy modules to understand the FHIR standard. In Module 3, we explore how FHIR is an enabler of the CMS interoperability and patient access final rule. The CMS interoperability and patient access rule has been announced by ONC to support seamless and secure access, exchange, and use of patient health information. It strives for greater interoperability and empowering patients to obtain and share their own health data easily and securely. The rule applies to state Medicaid and CHIP agencies, insurers that are qualified health plans, Medicare Advantage plans, Medicaid and CHIP managed care plans, as well as Medicare and Medicaid health care providers. Currently, the broader commercial market, including the SHOP plans and standalone dental plans, are exempted from this rule. The rule comprises of 3 tenets or guidelines for providers and 5 for payers. Let's see what the rule has in store for providers. The first guideline is around electronic notification for ADT events. Hospitals or health systems that participate in Medicaid and Medicare are required to send automated notifications around the admission, discharge, or transfer to other facilities and providers associated with the patient. These notifications need to be sent as soon as the admission, discharge, or transfer has occurred. The next guideline pertains to the prevention of information blocking. Under this guideline, CMS would publicly report providers that resort to any activity that could be considered as information blocking. The third guideline is around provider digital contact information. All providers need to maintain their contact information on the national plan and provider enumeration system. Providers who fail to do this would be listed on the CMS portal. We now see the guidelines for payers. The first guideline is around the exchange of patient health data. Payers need to share information like claims, encounters, cost-sharing data, and any other health information related to the patient, using APIs. FHIR enablement is an important step towards creation of these APIs. Next, the Cross-Payer Care Coordination Guideline empowers members to access past information when they switch plans. This is subject to member consent. This gives members and their new health plans a longitudinal view of health information that helps them keep an eye on spends and take proactive measures to minimize risks. The third guideline is around publishing of provider directory data with updated information within 30 business days. It asks for this to be done using open APIs. This allows members to access provider information easily using APIs and mobile applications. CMS also requires payers to participate in trusted exchange networks. This will allow them to share healthcare information with payers or provider both within and outside their own networks. The final guideline for payers is improving experience for dual eligibles. According to the CMS IPA rule, federal state data exchanges need to happen on a daily basis for dual eligibles. Now let's see how FHIR enables payers to align with the CMS interoperability and patient access rule. Payers typically exchange diverse data sets from disconnected systems with external entities like members, providers, hives, trading partners. They tend to use multiple standards like X12, HL7, CCDA, or custom formats, which adds to administrative overheads. The absence of a uniform standard means that payers end up with massive redundancies while sharing data with other payers. This leads to challenges in care coordination. The CMS IPA rule recommends FHIR to be the single standard for all data exchanged between payers and other entities. The use of FHIR enables us to create a single gateway that replaces multiple parsers and platforms that exchange data within the payer ecosystem. FHIR interface services transform and standardize multiple data formats to one standard format. They also help set up FHIR endpoint connectors. With a FHIR-driven API ecosystem, we eliminate the need for multiple parsers and seamlessly integrate all the data across siloed applications. The new interoperability environment also enables seamless data sharing with trusted exchange networks, which in turn simplifies data sharing with other payers. This FASTByte is brought to you by Sidious Tech. Our Fast Plus solution is an end-to-end FHIR implementation suite that enables healthcare organizations to address a variety of needs, such as setting up FHIR servers, pre-built FHIR APIs, identity and access management, consent management, parsers, data ingestion, data repositories, API management and bulk FHIR transactions. Fast Plus is supported by our healthcare interoperability team with more than 500 HL7 and FHIR certified professionals. To see how Fast Plus can address your FHIR needs, talk to us today.